Well, welcome to Focus Today. I'm your host, Perry Atkinson, and I am delighted and honored today to host a very special edition of Focus Today with Senator Alan Bates and Colonel David Dotterrer. And they're here to talk about the issues. That's what we're going to deal with today, the issues. And as you know, they're both running for the state Senate for the same position. Alan, you've served there how many years now?
3. This will be my fourth run at the Senate.
Fourth run of the Senate.
Yes.
And David, in the past, you worked on the House side with Dennis Richardson, and then you became a strategic guy.
Yeah, I worked for both Republican caucuses, both on the House and the Senate side, working as a strategic budget analyst.
There you go.
Working that. So I got a chance to see
the budget.
Well, not only that, I got a chance to see both chambers and how they are significantly different.
Oh,
it was interesting to go back and forth between the two different caucus meetings and then ask yourself the question: are these guys really in the same? Are these guys in the same party?
Yeah, they are quite different. I spent 2 years in the House of Representatives, and 60 to 30 is, the size is just hugely different.
Yeah.
And floor speeches, and you go in the caucuses like you did. I'm thinking, is this the same caucus I'm in the Senate? I mean, it's very different.
Well, gentlemen, thank you both for being here. I'm going to give you each a little bit to kind of tell us about yourself, and then we'll get into some of the issues. Alan, let's start with you.
I've lived here in the Rogue Valley for 35 years. I'm a primary care physician, family doc. Been treating patients in Medford and Central Point area, White City and Eagle Point most of the time. Chairman of Rogue Valley and Providence Hospitals for medicine for 4 or 5 years until I ran for office. 10 years in Eagle Point School Board. I'm a Vietnam veteran, served 2 years, got drafted. But I volunteered for Vietnam, went over, thought it was the duty, right thing to do. Went over and served my time, came back, and entered politics in 2001, and been working at that ever since, and still working in my practice too. I go up Monday through Thursday, and Fridays we're not open up there, and I come home and see patients Fridays, Saturdays, and Sundays, go back up. Keeps me grounded, you know. I mean, you get inside that thing sometimes, you kind of lose track of what's going on if you're not careful. And coming back to see patients really grounds you, really keeps you in touch with the people in your local community.
Very good. Thank you. David, tell us about you.
I grew up in Oregon and in the Eugene area, and after college, I went into the Marine Corps for about almost 30 years, just shy of 30 years, retired as a colonel. And what struck me was that I grew up in an Oregon that was prosperous and had good schools and great infrastructure and things like that. When I came back, I noticed that it was not the state I grew up in. And so that was concerning to me. And, I've now walked almost 11,000 doors here as part of this campaign, and what I'm consistently hearing on the doorstep is things are not going in the right direction. It's time for some change, and that's what we really need to do. And so, what I think it's time for new leadership and new ideas, a new direction, and that's what I hope to bring to the state legislature.
Okay, thank you, gentlemen. I'm going to go through some issues here and see what your thoughts are. And I think perhaps the biggest issue, and you probably both will agree, is job creation. Kind of probably would agree with that. So, David, let me start with you. What do you think the needs to be done for Oregon to help businesses grow and employ more people? And give me some specific ideas.
Yeah, well, a couple specific ideas. First off, let's look at what the issue is, what the problem is. My discussions with the small business folks, and I've been endorsed by the local chamber and also the small business organizations throughout the state too, is because what you're really seeing is you're seeing a state that is not as business friendly as it should be. One of the folks with the small business group in Oregon referred to it as the sticky web. You get yourself into this, and it's very, very difficult to maneuver your way through this regulatory structure. And then there's another side to it, of course, has to do with the education, but we can talk about that, I think, under the education piece. But there's a couple things that I think we can do. First off, the state of Connecticut has done this for 40 years. When they pass a law, they turn it over to the bureaucracy and tell them, okay, write the administrative rules and write the regulations. Okay, but those regulations don't go into effect until they go back to a legislative committee and they say, yep, That's the intent, and that's what we wanted to do. And I've called them, and they said that works quite well. You know, we really ought to look into that kind of thing. The other one that I really think we need to look into is this idea that if I want to expand my business, start my business, or do something like that, there ought to be a place at the state level, and including local offices, that you can go to help you, to advocate for you, to help you to maneuver through this regime and work with the various agencies, because people will tell you got to go to 4 or 5 different agencies. They don't match up and things like that. And this has got to be somebody at the, you know, at the state level, working with the governor, that's got some authority, that says, you know, I'm going to bring these 2 agencies in, and they just seem to be at odds with each other, and I just need to get that done. I think that would go a long way toward helping out.
All right, thank you, Alan. Again, what would you do to, or could be done, to help businesses grow and employ more people?
And there's lots of things we can do. There's not going to be one simple answer. If there was a simple answer, I had a silver bullet, we would have done it already. Okay, but there's lots of things we can do, we are doing, and more we need to do. Groups like Soretti here in the county is where you can go and get through all that regulation difficulty. And they're here, and they're doing a great job of it. They need to be strengthened. The governor's solutions program needs to be reinstated in a stronger way. When a company comes in, they can go to solutions team. They can go to Soretti. That's how we got Amy's Kitchen in here, and that's how we're going to get more business in too. And then we need to build on the things we've got already. The number one problem I'm seeing in Southern Oregon as far as job creation is not having the workforce we need. We are trying to hire people in various places. When I talk to Soretti, when I talk to Jim Fong down at the unemployment division, we've got openings, but we haven't got people trained in the areas we need them trained in. And so we're starting to change what the community college is doing, what Southern Oregon is doing, and trying to aim our high schools into vocational training and getting people ready for the real workforce we need here. When we talk to companies that want to come to the area, they ask us several things. Is it safe? We got a great safety place as far as people living here. Are your school systems adequate? Yeah, we're pretty good. And you saw the newspaper report this morning, we're doing better again, putting more money into it. And they ask, what's your workforce like? And that's where we have the most difficulty in Southern Oregon, and frankly on the coast and in Eastern Oregon too. We've got to turn this thing around, reinvest in higher ed, community colleges, and high schools, and really get the right workforce out there. That's the biggest issue we've got. At the same time, there's some specific things we can do also that I think will help us. One of the programs that, frankly, Portland used, and we're going to start using down here, is their development, or the primary person doing the development work up there in Portland, went to companies and said, who are your suppliers, and where are they located? And they found out where they were, and they go to those suppliers, which are in other states, and talk them into coming into Oregon based on some tax incentives, cutting through the red tape, getting them set up here, and moving those suppliers right in. We need to do that in our local area here, and we're just getting started to do that. So when you go to a major employer here and want to build them and help them build more, not just bring new businesses, but help the businesses that are here already, ask them where their suppliers are, and we'll send people out, talk to those suppliers, and bring those jobs up here into Southern Oregon.
All right, thank you. And in the same frame, I'll go with you, Dr. Bates. Do you think the corporate tax in the state of Oregon is too high?
I'm not sure it's a part of a bigger question. You can look at this in various ways. There's some studies that say we're 48th from the bottom as far as tax rates are concerned, lowest in the nation. If you look at a different way, we're a little higher. There are some issues here that need to be dealt with. I think the capital gains taxes in the state are way too high. That has to be discussed. Corporate taxes should be discussed. The kicker should be discussed. We need to have a robust discussion about how we're taxing people in this state, especially businesses, so that we have a fair way of taxing them that does not impede them from growing and bringing people in. I think our tax structure is antiquated, and that discussion is going to be one of the major discussions we're going to see in the next legislative assembly.
All right, let me ask a little addendum to that. You stated in your earlier question that you would create some tax incentives for some businesses to come in here. Mm-hmm. Why not give that incentive to all the businesses so they can grow?
I would not be opposed to that. Most of the tax incentives that you put together are short-term. When I say short-term, 5 to 10 years. You relieve them of some property taxes or something of that nature, and it's based on how many more people are you going to hire and bring in more jobs. those kind of tax breaks, I think, should be available to everybody. If an employer like you has moved to a new building like this, should you get a tax break for doing that because you're going to hire more personnel? I think that's an appropriate thing to do.
That'd be nice. Colonel?
Well, following on with that, I find it interesting because, in fact, that idea did come up with, we gave this tax break to Nike and to the larger corporations, and the push was, well, why don't we give this to everybody? We don't need to pick and choose here, and that was shot down in the legislature, and I completely disagree with that. And in terms of the corporate tax, it's not totally a matter of, is the rate too high and those kinds of things. It's the way that, in many ways, that it is done. The measures that were passed back in '09 that essentially told the corporation, well, even if you lose money, you still got to pay. You got to pay this corporate minimum tax. That was a mistake. I would very much like to see that. Get rid of that, because I even have a close personal friend who he had a corporation and he just changed it over to an LLC. He just changed his structure. Well, what you're doing is you're causing business people to make business decisions, not based upon the economic realities of the world, but based upon what the state decides to choose is going to be their tax structure. And that's not the way we should be doing things. And that's a very inefficient way to do things.
Can I add something to this?
Sure.
One of the things we don't do well in this state is we don't make it clear to businesses that we are open for business. I'll give you an example of something we do in the state that other states don't do. Back in 2001, Lynn Shedley and Representative Williamson and I and a couple others, these are Republicans from the North, sat down and did a very difficult thing. We made Oregon one of the few states that is a single factor corporate tax, and that means if you're manufacturing this state and you send material out or manufacture material out to other states or overseas, you're not taxed anything that goes outside the state. We're one of the few states that has that, and we don't make a big enough point about that. Many states tax everything that's made in the state, no matter where it's going, and collect that revenue. We don't, and we do that to help businesses, large and small. And that's the kind of information we need to talk to companies that want to come here and companies that want to build and get larger here. And that's the kind of information we need to put out, and we're not doing that. I admit we're not doing that.
I agree. You're not communicating that.
Yeah, we absolutely are not. Yeah. I know that, there's been these trips to China and those kinds of things, and it's been difficult to get some legislators and to go along on those kinds of things. My goodness, why wouldn't we want a market of 1.3 billion people? That's crazy not to do that. So we need to do that outreach. And if you talk to business folks around here that do that outreach and kinds of things, that they find that the state agencies don't do as good a job. Business Oregon just doesn't do as good a job as it should. All
right, let me take a break here, gentlemen. We'll come back. We'll get into the other topic that I'm sure that you're finding on your campaign to be very interesting, and that is Cover Oregon, the healthcare issue, and also education. So we'll take a quick break. We'll be back with Senator Alan Bates and Colonel Dave Dotterrer in just a moment.
Hi, I'm Paulina, and I work at theDove TV. Did you know that when you support theDove TV, you have a profound impact, not only in our community, but around the world? It's your continued support that takes the inspiration and hope in the programs we produce and makes them available to the thousands of people who are watching these videos online every week. Help bring encouragement and hope to our valley and beyond by making a secure online donation today at our website, thedove.us.
Okay, we're back, and our special guest today is Colonel Dave Dotterrer and Senator Alan Bates, and we're talking about the issues. You're going to choose one of these gentlemen to be your state senator from Southern Oregon. Gentlemen, I want to move into the whole issue of Cover Oregon. It's certainly a hot topic these days. It's in the news a lot. Some would say that Cover Oregon's been a total disaster and failure. Some would say it's working. I'm sure you both have your views on that. $300 million plus. Basically has gone down the drain. I would think that would be some pretty good cash to be used in some of these counties around the state that are hurting. But let me start with you, Colonel. Your thought about Cover Oregon, where it is, where it's going, and
Well, first off,
what are we going to do with it? It's a mess. What are we going to do with it?
Well, let me make one correction. The $300 million is federal funds, and it wasn't even available to go. So, but a different issue.
Yeah.
Well, look, absolutely. It's very clear it's a disaster. And it very clearly was a leadership failure, I believe, both on the executive branch and on the legislative branch side. And just talking on the legislative branch side. There's an audit committee that's supposed to be formed, an IT committee, and that was never formed during the 2013 session. Too busy. They did form nominally a small little committee, but that committee didn't know that there were quality assurance reports being done, and that we had a staff member that was actually working on this particular issue. And I sat in numerous meetings, including with the director of Cover Oregon, and listened to him and thought, wait a minute, I'm looking at the quality assurance report and it's virtually all red. I mean, it is, and that's a year before launch, and he's singing the praises of it and all stuff like that. And that's where as a legislator you got to dig in and say, wait a minute, I'm getting two pieces of information here. This is not right. So that's the piece, and unfortunately. With too many of the projects we do, and let's not just talk about IT projects, because that's, at the end of the day, that's not what Cover Oregon really was. I mean, Cover Oregon was meant to be a program that took care of a specific issue with healthcare. I mean, and we made promises to people, and they failed miserably. They just didn't do it. So that piece of it needs to be considered also. But again, it's just unfortunately it's just too much. Well, first off, I haven't seen the legislature at all since the demise of Cover Oregon really sit down and the audit committee get together and say, okay, let's do a postmortem on here and what happened and what we did, what our role was. Now that's been done on the executive branch side, and I applaud the governor for that. But there's a role in oversight on the part of the legislature, and that clearly was not done. I mean, I'll stop there on it for right now.
Okay.
Yeah.
Dr. Bates.
Yes. Your question was: is it a complete failure? Yes or no?
Yeah.
And the answer is yes and no. Okay. The failure was the IT portion of it, total and complete failure. There was a lack of oversight in the executive department on this. We all voted for the IT portion. Dennis Richardson, myself, and we all voted for it. So this looks like a good business plan. Let's lay it out. Let's go do it. Okay? It'll be federal funds coming in. It's not going to cost us personally in the state any money. Let's do it. It'll actually make jobs here, and they're going to do something that no other state's doing, blah, blah, blah. The whole thing we relied to all the way through till about 9 months out of go live. At that point, the red lines started coming up. The IT committee started getting concerned. The audit committee wasn't even meeting. The thing just fell apart. It was a total disaster, and I'm not going to argue that any other way that it is. We passed some laws in the short session in February to change how we contract, and there will be a really careful look at this when we get back in the full session, because we've been out of session basically since this thing fell apart. On the other hand, what was Cover Oregon really trying to do? We're trying to get everybody in Oregon health insurance. We have 95% of the people in Oregon now insured, and that's because of the Affordable Care Act and Cover Oregon. A lot of that's been in Medicaid. A lot of it's also been in commercial, through the commercial exchanges. And those were a tremendous success, actually more than we expected. Almost twice as many people got involved than we expected, and now they're all insured. So what does that mean when you have this insurance is the real question for individuals. It means people that weren't getting their mammograms get their mammograms. Colonoscopies, all that preventative health care is now going on. And inside the exchanges, we have a new kind of benefit plan. High deductible, so that people have some skin in the game, which we've always wanted, but no skin in the game for preventative care. We want them to get that preventative care, and then go on through and look at what they really want to spend their money on after that. We don't want people facing bankruptcy because of a health care issue. And we want businesses, especially small businesses, not to be burdened by health insurance, which drives them under sometimes, and we're going to take care of that for them so those small businesses can thrive. We brought $1 billion into the state because of Cover Oregon. That money's going to hospitals, doctors, nurses, medical assistants. Many of the small businesses in the state that couldn't afford benefits for their patients, sorry, I'm a doctor, you know, for their employees, you know, now have that covered for them. You just saw what Walmart's doing. They're saying, hey, you know, we can't afford these costs for our part-time workers, so we're going to roll them back, and they're going to go on to Medicaid or through the exchanges. Small businesses will have an opportunity to say to their employees, you know, we really can't afford this, but we'll give you something towards putting you into the exchange. You'll get a tax credit from the federal government on this, and you'll be able to buy the insurance you want, and you'll have lots of choices. This thing's rolling in the right way. And frankly, I kind of hate to admit this sometimes, the plan for how we did this really came out of a Republican think tank. The Cato Institute's the one that lined this thing up, saying, listen, how do you get skin in the game for people? How do you get everybody insured? How do you have personal responsibility? And it was all done. So this has been a roaring success from that side. The IT portion, absolutely a wreck.
Hey, I know you want to comment on, and I want you to. I have one comment on myself. Why doesn't the citizens of this state believe it's a roaring success? It polls 0. I don't think there's a person out there that believes that this is a success. Are they not hearing what you just said, or they don't believe what you just said?
When they hear Cover Oregon, they think, you know, IT.
Yeah, yeah.
You know, all they've heard is how terrible it is.
Yeah.
When they think, gee, my next door neighbor has insurance now, they don't associate that with Cover Oregon because it's never been discussed.
Okay.
You know,
Dave, I know you want to respond.
Okay, well, and I'm going to disagree on the Cover Oregon provided this insurance. Well, you know, Cover Oregon is claiming that they signed up 500,000 people, 500,000 people. Just short of 400,000 of those are in the Oregon Health Plan. I mean, which was part of the Obamacare Medicaid expansion plan. Cover Oregon, I believe, had nothing to do with that whatsoever. First off, with that first 400,000, 140,000 of them were signed up by the Oregon Health Authority before Cover Oregon even came into existence. So we can't give Cover Oregon credit for that. Not only that, you know, we had a perfectly good functioning organization that signed people up for Medicaid beforehand. So why send it over to Cover Oregon, waste $300 million? Now it's going back because the federal exchange doesn't do Medicaid signups. So we didn't need to do that. And then the other thing is, there really hasn't been that many people sign up for the private insurance. Just a little under 70,000 people total. And the vast majority of them are the subsidy, because you can't get the federal subsidy unless you sign up to an exchange. But there's been a nominal number of people that have actually signed up for the private insurance along the way, and we're looking at probably 15, 16, 17,000 people is all. And so, you know, I think it goes well beyond the idea of just an IT failure. There's some programmatic failures here too that need to talk about.
Let me make one comment before we take a break. If Congressman Walden has called the feds in to take a look at this, and it's possible the feds could come back and ask for their money back. And in the meantime, the state wants to sue Oracle for the mess up. That could be a double financial whammy on the state. We'd have to pay the money back, and we'd have to go hire a bunch of lawyers to sue Oracle with no guarantee we're going to win. How do you fiscally justify that?
The lawsuit against Oracle is going to be handled by the Attorney General's office. There'll be a cost to it. And they'll have to bring some other people in to do it. Whenever you go to court, you take a chance. I think we should get that money back, okay?
And how much would that be, Alan?
The cost?
Yeah.
I don't know, probably in the neighborhood of 4 or 5, could be as much as 4 or 5 million against the 300 million, okay? The idea that the federal government's going to come in and ask 20 states or so to give the money back to the feds, just not going to happen. I mean, let's get realistic. That's just not going to happen. And I think what you're going to see is the opposite happen. When the states that are receiving this money start helping the small businesses out, and that's going to be a boom for them, you're going to see more and more states going the same direction we've gone. And I think after this election, they're going to start rolling in that direction. You can't be in a situation where you're competing with the state next door who can start driving down healthcare costs as we do because of what's happened here. You know, our cost for our public employees' health insurance is flat this year, a 0. we're driving down healthcare costs and Medicaid too. You can do that by getting everybody insured and getting proper organizations set up. So I think everyone's going to follow this, and you've already seen states flipping over and say, yeah, we're going for it now.
All right, you want to respond to that? And I got to take a break.
Sure.
Go ahead.
Well, you know, I agree. Whether or not we're going to have to pay that money back is, of course, is an entirely different issue here. Yeah, I'm concerned about it, but you know, it may happen, it may not. You know, but it just kind of tells you this horror story just keeps getting worse and worse. I mean, this morning they just discovered that they signed up Senator Merkley by mistake, and in fact, in spite of the fact that Cover Oregon, they signed him up through Cover Oregon for Medicaid, and the guy makes $175,000 a year. I mean, you know, those kinds of things are happening, and it's just, you just go, geez, you know, let's just shoot this thing.
Well,
you know, and I don't, Alan, I don't see where, you know, we haven't, you know, I haven't heard any small businesses tell me that this is helping them anyways, because they're not, that portion of it isn't really working at all. People just couldn't get on there.
I'm sorry, I disagree. And, you know, there are mistakes being made in the IT thing still. Senator Merkley being a good example, okay? But the bottom line is this is going to help small businesses, it has. And if nothing else, it helps hospitals and doctors and nurses. We used to have to do this care for free, and cost shifted over to the other part of the insurance industry. That cost shift's going to go away. In the long run, it's going to be the direction we need to go. We need to get everybody insured in this country, do preventative care, and drive health care costs down. We spend more money per person than any other country in the world, and we rate about 40th in outcomes. The only way we can change that is to get everybody insured and do preventative care, and that's the direction we got to go.
And the question is that the way through the state that has done such a poor job of doing this? Is that the best way to do it? I'm saying I have my doubts.
All right,
I got
to take a break.
that point back.
All right.
Okay.
All right. Time out. Let me take a quick break, and we'll be right back. We're going to move over into the area of education, which is probably equally as touchy as this one is, and we'll be right back with Senator Alan Bates and Colonel Dave Dotterrer.
Hi, I'm Paula, and I work at theDove TV. Every day we get letters and emails from people who've been encouraged, blessed, and challenged by the programs on theDove TV. But we couldn't do it without you. Did you know that more than 90% of our income comes from people like you? You can help us continue to bring inspiration and hope to our community by making a secure online donation at our website, thedove.us, or call us at 541-776-5368.
Okay, we're back, and we're having a robust discussion even during the break, and we should leave the cameras going on here. This is great. In fact, gentlemen, if you don't mind, I think we ought to just pick up where we left off. We can get to education in a minute, but thank you for watching today. Our special guest in the studio today is Colonel Dave Dotterrer and Senator Alan Bates, Dr. Bates, and we're talking about Cover Oregon and the pluses and minuses and what they both think about. Now, you made the comment about the coordinating care organization. What do you mean by that? What do you want to say about that?
Coordinating care organizations are unique to Oregon. There's 16 of them in the state now, and what we do is we give a global budget to an area in Medicaid, and now we're also putting public employees in. We give them a global budget and say, this is how much you're getting for the people you're taking care of. No more, no less. And it gives them an opportunity to put that money into mental health, drug and alcohol, physical treatment, work out rates with hospitals and doctors. And when you look at that overall global budget, we're seeing decreases in costs, significant decreases in costs. We had some upfront money from the feds that set the programs up, but that's going away very quickly. We're holding costs at about 2 or 3% of the Medicaid population as far as annual increases. Now, I'd be the first to admit, if we kept the old Medicaid system and just insured more people in Medicaid, we would not get the job done we need to get done. But coordinated care organizations like All Care and Jackson Care Connect are doing a wonderful job with local leadership, local physicians and hospitals coming together, and that's being spread across the state, is bringing costs down. That, to me, sometimes you get all wrapped up in the media and the sound bits, but what really works in Oregon is increasing the people in Medicaid and the rest of the state for insurance and putting them into systems that they get great care, better outcomes, healthier population, at the same time bring costs down. We are the only state doing that right now, and we're going to be a marker, I think, for the rest of the nation. We're also a marker, unfortunately, for IT failure too. Okay, but as far as what we're doing on the ground, it's the right thing.
All right, Dave, you want to respond?
Yeah, I do want to say one thing. Alan had said that that Cover Oregon was bipartisan in the past. But I can tell you that people like Dennis Richardson was the one who insisted that we have this quality assurance. And there was a lot of people, I sat in both caucus meetings for the Republican caucuses when they discussed this. And there was some opposition to it, but in the end, it was, okay, look, we've got this oversight. They have to report back to the legislature. We're going to take care of this. And people said, oh, okay, well, I'll go along with that. In fact, I remember Dennis specifically at a caucus meeting having to make the point, hey, look, guys, here's the checks and balances we've got in here. And because you didn't have that oversight then, that's where it fell apart. But I think the coordinated care organizations have a lot of potential out there. I think that the jury is still out, and we'll see whether or not we're gonna see any of the those savings or not. But the interesting thing is that the only longitudinal study I've ever seen of what the new OHP, the new Medicare expansion is going to cost the state of Oregon went out about 10 years. And you get out to about the end of this decade, and you're looking at about according to the Oregon Health Authority, you're looking at about $1.5 billion budget hole in there. And that assumes these savings that Alan's talking about, because we've expanded the program so much. Yes, we are saving money per patient, but when you add, I mean, literally, 25% of the state of Oregon is now on Medicaid. I mean, it's 990,000 people or something. Almost 30% of Jackson County. You add that many people on, and you're gonna create some budget problems. That's almost about a 9% general fund budget hole out there. Wow. And you're going to have to go to the education budget to find that, because it's 50% of the budget. That's my concern about it, and I think that's something we need to look at. But it's true that coordinated care organizations are designed. I mean, it's written into the law that this is all the inflation you're going to get, and when you sign up for the program, you buy into that, and that's the way the budgets work. And I thought that was a really smart thing to do, and put a marker down.
Yep. And I'll reply by saying I was the guy to put that in there, okay? and we put it in for public employees too. Put it in for both, and frankly, one of our members took it out, and the governor put it back in, and so we have a cap now on that stuff. If you look at our revenue coming up and you look at healthcare, it goes like they come together and go over the top. But if you put in the CCOs, it starts doing this. And that delta, that difference, that has to occur. If it doesn't occur, we're going to be in trouble. Already we're seeing it start to occur, but if it starts going back up, we're going to have to do something different. But if it continues the way it is, that difference there is going to be how we're going to put money back in higher ed and community colleges and K-12. Others may disagree with that. The 10-year curve I've looked at, if the CCOs are successful, we'll have that money. If they're not successful, we're going to have a real problem on our hands and have to rethink a lot of what we're doing.
I just would tell you that the 10-year curve I saw, I mean, I actually, I was given the chart for the Oregon Health Authority over a year ago. I looked at it, and I saw this little portion of it, and I happened to be sitting with the governor's budget director. And I said, George, what is that? And he said, it's a budget hole. And I said, George, that's $1.5 billion. I mean, we're talking about a lot of money here. Now, if that's true, and he said, well, we're working on closing that gap. Okay. I've never seen another longitudinal study since then, and we've asked for some, but it would be nice if somebody would sit down and say, look, this is what these really costs are going to be, because we've made some promises out there for this. You don't back out of this. Once you go into the Medicaid expansion, you're there. So now you want to go to education. That's where the issue is.
Okay. let me just move on a little bit, and we'll get into this. We'll probably have to take a break. But there was a former senator from Southern Oregon that's had a writing bill for quite some time in the legislature, and that is during the budget process, as we all know, education was the political football that got kicked to the end and used emotionally to raise funds. But the proposal was fund K through 12 in the first 180 days of the legislature. I think it even had a little bite to it, or go without your pay. So let me go to you first, Colonel. What do you think of that idea?
Well, what I find amazing is we did it. The legislature did it in the 11th session when you had a truly bipartisan, I mean, you had that 30-30 split in the House, you know, and having been part of those discussions, working with, at that time I was working very directly with Dennis Richardson, and they pushed that through and said, look, we know what the number is. Let's send them, let's tell them what the number is. And yet, when we went back to, in the 13th session, it went back to the old way of doing things. And I never quite understood that. I mean, you only had one party in charge, and that actually makes it easier.
Yeah.
You know, but there was, and I just didn't understand that. No, no, whether or not you need the law or not, that's a whole different issue. But I do think that it's very, very clear. You know, actually, having been a Marine commander that had to put up with continuing resolutions by the Congress, and actually at one point not getting my budget until I was a third of the way through budget execution year. I mean, literally. I mean, you know, and I know what that does to the efficiency. And so, so moving it up is really important.
All right, and Alan, I want you to respond to that. And let me just add to this a little bit. I think he touched on it on the end there. Are we being fair to teachers and administrators, keeping them in the dark this long until the end of the session? Why can't we give them the number early on in the game?
Yeah, we can give it to them earlier, and we've been doing it. First off, first 180 days, we have 150-day sessions now, so we should beat that number right off the bat by 30 days. Because you know, here's what hangs us up. A couple things. There are partisan politics involved in this. Unfortunately, it shouldn't be. But what really hangs us up is our May forecast. We have to base our two-year budget on the best data we have as far as what the revenue is going to be like for the following 2 years. The best number we get is the May forecast. We get the May forecast because you pay your taxes in April, and we are dependent on the income tax for that. So we have a built-in problem here. But I believe that as soon as we get that May forecast, which we get about mid-May, we should be able to roll that budget out in a week or two and get it out quickly. And even then, understand, I was on the school board for a long time. School board members and superintendents are looking in June, a month and a half, 2 months later, about that first year. The second year, they'll have certainty, okay? But even then, putting it out that late is difficult. So we need to move this to as soon as we get that May forecast and have a pretty good idea of where we're at, although it's not perfect. We need to move that budget right there in that spot.
I'd move it. I'd move it the 1st of March. I'd go with the February forecast and put it in there. And if you're, for some reason, your May forecast has got some kind of a big change, which it typically doesn't, but it might. I'd go back in and change it again. Make some. But it's a minor. It'd be mostly would be a tweak. I think. I'd just do it.
Let me take a quick break. We'll come back. I'm going to speed you guys up, ask for some short answers, and try to go through a lot of quick questions in the last segment. So stick around. Senator Alan Bates is with us, and Colonel Dave Dotterrer. We'll be right back.
Hi, I'm Daniel and I work at theDove TV. Compared to Portland, Seattle, and LA, Medford might be considered a small market, but at theDove, we're excited about the opportunity to make a big impact right here in our community. And you help make that happen. Did you know that more than 90% of our income comes from people like you? You can help us now by making a secure online donation at our website, thedove.us, or by phoning 541-776-5368.
Okay, we're back and our discussion today with Senator Alan Bates and Colonel Dave Dotterrer. They're both candidates for Senate District number 3. Dave Dotterrer is the Republican nominee, and Senator Alan Bates is the incumbent Democrat. And we've been going through some key issues here: job creation, Oregon healthcare, education. Gentlemen, this is our last segment, so I'm going to ask you to help me with some very short answers. I know that you're both candidates and you like long answers, but help me out. Let's get some short answers and see how we can do here. Well, let me ask you this. Well, let me start with you, Alan. Would you be in favor of school choice or a voucher system?
I am in favor of school choice from the point of view of having open enrollment on our districts. I fought hard for that. I don't think anyone else in my party actually voted for except Peter Courtney and I. And so we have open enrollment as an example in Ashland. I think we should have open enrollment and everything so parents have a choice to go whatever public school they want to go to. Okay. I think that competition between districts is vital to make the districts better. I know the OEA doesn't agree with that, and I know a lot of my party doesn't, but I really think it improves everybody.
Okay.
David? Yeah, I would expand it beyond even just for the public schools, though. When you talk about choice, you know, we really need to make sure that people have got the choices for charter schools and virtual schools and homeschooling, those kinds of things. We need to make sure that. As to the voucher system, yes, I absolutely think we need to take a look at that, at a voucher system. I mean, my view is that, you know, that what we're really, the goal is an educated adult. How they get there is a different question.
Okay. Start with you, Colonel. If you could cut 10% out of the state budget, where would you start?
I think you would have a lot of trouble cutting 10%. Now, you might be able to cut some of you might be able to cut some of the increases and like that. But you know, there's a lot of things in there that are on autopilot. You know, healthcare is one of them. You got to provide for the welfare system. You know, those are federal state issues. I mean, and you know, the simple fact of the matter is, you're asking me what would I do?
Yeah.
I would fight that to the bitter end, because at the end of the day, it's the only place you could go to would be education. Really, there's virtually nothing else that you could go to, and you can't take 10% out of that budget. There's just no way you could do that. So yeah, that would be my answer.
How about you, Al?
Well, it's a terrible thing to have to do. We actually basically had to do something similar to that in this horrible recession. We went through the Great Recession. What we tried to do was stay away for as much as we could from K-12 and higher ed and community colleges, which we didn't. We still cut them. We tried to do everything we could to keep basic services going for developmentally disabled people, for senior programs, and we cut them a little bit also. But what we really did was we started furloughing without pay, went to furloughs in a lot of sections of state government, took every Friday off, every Monday off, whatever it took, furloughed those people, and we put a freeze on hiring. Now that did affect some agencies pretty heavily. I'm thinking of DMV and some others that had to make some changes, but we had to do that in order to protect the basic services we needed. And frankly, the Republicans and Democrats came together on that. It was such a crisis that we had to figure this out together, and we basically did. But I never want to go back and do that again, because what got hurt the most, I think, in the long run, was higher ed and community colleges. Percentage-wise, they took a bigger hit than everybody else. The result was, even though more people were going to college during that time, more people going to community college during that time, the rates of tuition just kept going up and up and up.
Just to go back to that idea too, the point was that crisis was predicated on about only a 2% reduction in revenue. I mean, the crisis was because people were expecting the revenue to go up more, but it actually went down. But it was only a 2% cut. So you asked the question about something 5 times bigger than that. And that's why I answered the question the way I did. You know,
it'd be horrible.
Think, you know, I think we business people and citizens, we're forced to make 10% cuts. Well, I have to do it all the time here as a business.
The answer would be, you know, you're going to have to go to the 50. The answer would be you would be forced to go to education, because it's more than 50% of the budget. I mean, it's just it's raw. It's raw numbers. Now, you wouldn't want to go there,
no,
you know, but that's if you said you can't leave the room until you cut 10%. I can see right now. I don't, you know, that's what the legislators have to do. They massive cuts.
If you truly had to go to 10%, you go either to education or you go to human services, and primarily Oregon Health Plan.
Okay,
that's where you'd have to go. One of those two.
All right,
that's where the money is.
Yeah.
Well, let me ask you, Alan, do you believe that undocumented citizens should be given a driver's license and qualify for benefits, such as food stamps, or maybe even use that driver's license to get on an airplane?
Well, first off, this is a federal problem, number one. The federal government's got to step up sooner or later and resolve this issue. And it's crazy for every state to have to put up with this. I really think the states like New Mexico and Texas and Arizona and California got it worse than we do. As far as driver cards, I'm in favor of them because it's a safety issue. I know there's lots of arguments both ways. I want to go back to where we used to be. We used to give them driver cards, and they can get health. They can get insurance then for their cars for driver. They get them and pass a test and hopefully make things a little safer. I don't think they should receive other benefits. Okay, I just don't. Admittedly, there's going to be times they're going to come into hospitals with terrible diseases. We're going to pay for it. We've had some really expensive cases that came in. We take care of them. We don't let people just die in this country. We had to cost shift that. But for the most part, you've got to find you've got to be given enough to say, yeah, you're here, you're working, we appreciate that. You're here illegally. We've got to give them a path to either citizenship or a green card, and have a definite way of doing that. Give them the cards, as we used to. And call it good, okay? And that's the best we can do. And the rest of it, no, I don't think we should be rolling out the carpet for people who've come here illegally, but we should support them in getting into a situation where they can get their green card or move into citizenship.
How about you, Colonel?
None of the above. As far as I'm concerned, I'm dead set against those. With the driver's card, I just don't think, I mean, it falls in the category for me of, you know, what part of illegal don't we understand? I mean, if this person's here illegally, you know, the state should not be issuing them an official document and everything like that. And we now know that, according to the Oregonian, that in fact it has become somewhat of an ID, you know, for the TSA, things like that. So it just was the wrong thing to do.
All right, I'm going to ask one more question and give you guys a quick chance to make a closing statement. Let me start with you, Dave. Measure 91 on the bill legalizing marijuana in the state of Oregon. Your thoughts?
I think the prudent thing to do is to wait and see the outcome of what's happening in Colorado and Washington. I really think that you know, they're running the experiment for us. They're running the beta, and clearly there's a lot of issues revolving around this. So let's let that play out. That would be the prudent thing to do.
Alan?
It's coming one way or the other. Whether you like it or don't like it, we're gonna legalize marijuana in the state and other states sooner or later. I'll accept whatever the voters do at this point. If they vote for it this time, okay. If they don't vote for it, okay. But we'll see it probably in the next 5 or 6 years being legalized. We're learning a lot from Washington and Colorado right now, and we're going to learn a lot more as those programs roll out. I'd like to have a little more time on it. I wish this was something that was rolling out 2 years from now, not right now. That said, at least this particular bill is not constitutional. In other words, if it does pass, we can go in there in February, and if there's obvious changes need to be made, and I think there are, I've read the bill, then we can make those changes. As an example, that bill right now, the way I read it, prohibits local counties or cities from taxing this, and I think they should be able to do that. They're going to bear the burden of having it out there. Yeah. So that kind of thing is.
You got a lot of municipalities doing that now, trying to pass. Yeah.
And I think they have a right to do that.
All right, 30 seconds. Go ahead, Alan. Close.
Okay.
Make your pitch. There's the camera.
Well, we got a lot of unfinished business up there. I've had a lot of experience there, and I want to see that finished go the right direction. We've got difficult times coming up yet, even though we're coming out of this recession. I have the experience, knowledge, and leadership, I think, to lead that charge and to be a big part of it. And I want to look forward to doing that again. And I want to say also, it's been an absolute honor and privilege to represent Southern Oregon in the state legislature. And it's one of the highlights of my life and something that I will always look back on very fondly. The people I've met, the wonderful people in Southern Oregon, I would never met any other way. It's been just a wonderful experience, and I look forward to doing it again for 4 more years.
All right, thank you.
Well, you know, Perry, there's 2 ways to govern. One way is through leadership, and the other way is through crisis. And if you look at Cover Oregon and the fact that over the last 10 years we've gone through a couple of budget crises and things like that, way too often, far too often in the state of Oregon through the legislature, we govern by crisis. And that's got to stop. And what I really believe we need to do, and what I want to bring to the legislature, is this idea that what is the role of state government? What are the things we need to get accomplished, like jobs? And then what else needs to get taken care of? So.
Well, gentlemen, thank you both. I appreciate it. You can go to their websites, individual websites. We're out of time. Give yours real quick, Alan.
It's SenatorBates.com.
Okay. And yours?
DaveDotterrer.com.
DaveDotterrer.com. Go to each one of their websites. Gentlemen, thank you. And thank you for setting a good example that we can talk about the issues and do it in a very gentlemanly way. Thank you both. Best to you. And whichever one continues or goes on to serve, think of us. We'll see you next time on Focus Today.
Thank you.
Hi, I'm Jim, and I work at the Dove TV. Every weekday between 6 and 8 a.m., our award-winning news and sports team bring you the best morning show around. It's live, it's honest, and it's a whole lot of fun. And you help make it happen. Did you know that more than 90% of our income comes from people like you? You can help us continue to air local programs that share your voice by making a secure online donation at our website, theDove.us.